Upper eyelid, blepharoplasty, to cut or not to cut. How we can improve, how we can lift the eyebrows. If we can lift our upper eyelid, really, is it possible without surgery? Let's move on. I am Maria Fedchuk, a dermatologist and anti-aging medicine specialist, and let's go deeply into the details. How come that while aging, our eyelid starts to lower? It becomes drooped somehow. Why it happens? Because of all the changes. You remember already that the bone support gets lower, so the bone actually shrinks. Then the deep fat, we lose deep fat. What does it mean? We lose deep fat in the temporal area. We lose deep fat on the bone in the forehead, and we lose the deep fat here in the eyebrow area. So if, for example, when we were 25, we had our eyebrows being very beautiful hills and they supported our upper eyelid. But later, at the age of 30, 32, we probably already saw that somehow we had some drooping of the upper eyelid. And at the age of 35, unfortunately, we lose around 70% of brow fat. At the age of 40, around 80. Can you believe that? So we do not have our heels anymore. And if we do not have our heels, we do not have the support which actually holds the upper eyelid. And as well, so we lose the fat tissue in the forehead. And because of all those structural changes, our upper eyelid droops. So in order to improve this, we have two approaches. We have surgical approach and non-surgical approach. Surgical approach is so famous, it's so fast, it has downtime, and it's so common. It means that you just go to a beautiful colleague of mine and surgeons, they just cut a piece of skin. They cut a piece of your upper eyelid, actually sewing, then you have a shortened eyelid. Does it really change the structure changes? Not really, because this kind of surgery doesn't restore and doesn't affect actually the cause of those aging. So we have the other approach, where this approach I stand for. We can restore step by step all the structures that we had. For example, first, we can improve, and that's number one area I would go for, we improve the temporal area. And by injecting the temporal area to support the brow, the upper eyelid first, then we can restore the volume of the deep fat that we had in the forehead area. And probably you already saw that there is a little bit of fat loss in the forehead area, like holes somehow. And because of that, we didn't have enough support for our upper eyelid. And what we can create, we can reshape actually the eyebrow. Yes, with the hyaluronic acid filler, just Juvederm Vollift, which is the European brand, and Juvederm Volure, which is here the US brand. So this is the Vicrys technology. I have already talked about this. It means I will not create any swelling in the eyebrow area. So I'm absolutely confident that this area can be reshaped. Our eyelid can be lifted up without any unpleasant consequences. So to restore this non-surgically, we can do that quite like 15-minute treatment and without any downtime. This is the deep restructuring. The superficial work can be directed onto skin contraction. We can go for all the resurfacing methods. For example, we can work with laser resurfacing, CO2 laser resurfacing, erbium laser resurfacing, which creates like small channels of damage, and then this small channel of damage creates a crust goes up, and because of the area around the channel, the skin can be easily regenerated, and thus the skin can be contracted, and you can go even on the upper eyelid itself. So like you can work with a very, very thin skin. One of the very good technologies over there is actually the plasma technology, where you can use for the contraction of the skin in the upper eyelid with the small crusts, which are after small damage because of the plasma, not even touching the skin. We can improve, so contract the skin first, then regenerate it, and obtain actually totally new skin. The other possibility is to work with microneedling fractional RF, but this is very important to understand the parameters so that not to be very powerful or strong, so that heat doesn't affect the fat. And it's so important in that area to keep the fat untouched, so that to prolong the youth. So with microneedling fractional RF, we can combine with chemical peels in that area as well. We can combine chemical peels with microneedling all together, which contracts the skin as well. And all together, after damage, we can go for repairing and restructuring the area with growth factors, cytokines, exosomes, hyaluronic acid to improve the skin quality and to help the skin heal after our damage. So this area can be easily restructured with temporal, brow and forehead area reshaping for deep structure support to create our heels, and superficially with the skin to contract the skin and regenerate it. And I do hope this was something that is new for you and probably you haven't never heard about. If this is the case, could you please leave the comment below that this was really useful for you? I would appreciate that, and it makes me produce more informative video for you so that you know much more about non-surgical approach, how we can support our beautiful longer. And of course, do not miss my future videos, so please subscribe. Hugs!